Adenovirus Outbreak 2023 in West Bengal. Adenoviruses are small, non-enveloped viruses that have a double-stranded DNA genome. There are over 50 different types of adenoviruses that can infect humans, and they are classified into 7 different groups, based on their genetic and antigenic properties. Adenoviruses are highly contagious and can be transmitted through direct contact with an infected person, airborne droplets from coughing or sneezing, or contact with contaminated surfaces or objects. They can survive for a long time on surfaces and in the environment, making them particularly difficult to control. West Bengal is now dealing with a worrying issue as a result of an increase in occurrences of flu-like symptoms in child brought on by adenovirus. According to reports, since December of last year, the adenovirus has been seriously affecting children. Deaths in 3 suspected cases among children in Kolkata have caused a scare. Around 33% of the 500 total samples tested between January and February 3rd week are positive for adenovirus. Within a span of 1 day sounded alarm over the rapid spread of adenovirus in the city and various parts of West Bengal. 2 of the victims were 9 and 8 months old and the third a year and a half. While the 9-month-old was a confirmed case of adenovirus, a confirmation is awaited on the other 2 cases. Let us discuss all the questions those are frequently being asked on adenovirus infection. What are the symptoms of adenoviruses? The symptoms of an adenovirus infection can vary depending on the type of virus and the location of the infection in the body. Here are some of the most common symptoms of adenovirus infections. Respiratory infections. Runny or stuffy nose. Sore throat. Cough. Fever. Headache. Body aches. Fatigue. Conjunctivitis, pink eye. Redness of the eyes. Watery or pus-like discharge from the eyes. Swelling of the eyelids. Itching or burning sensation in the eyes. Gastroenteritis. Diarrhea. Vomiting. Stomach cramps. In severe cases, adenovirus infections can also cause pneumonia, meningitis, encephalitis, and other serious complications. It's important to note that adenovirus infections can often be asymptomatic, meaning that a person can be infected with the virus and not show any symptoms. Additionally, the symptoms of adenovirus infections can be similar to those of other viral or bacterial infections, so it's important to consult a healthcare provider for an accurate diagnosis and appropriate treatment. Who gets adenoviruses? Adenoviruses can infect people of all ages, but certain populations are more susceptible to infection and may be at higher risk of developing severe disease. These populations include infants and young children. Children under the age of 5 are more likely to get adenovirus infections, especially respiratory infections and conjunctivitis. People with weakened immune systems. People with weakened immune systems, such as those with HIV, AIDS, cancer, or transplant recipients, are at higher risk of developing severe adenovirus infections. People in daycare settings. Children in daycare settings are at increased risk of getting adenovirus infections due to close contact with other children who may be infected. People in crowded space are at higher risk of developing adenovirus infections due to close contact with others who may be infected. How are adenoviruses spread? Adenoviruses are highly contagious and can be spread in several ways, including direct contact with an infected person. Adenoviruses can be spread through close contact with someone who is infected, such as kissing, hugging, or shaking hands. Airborne transmission. Adenoviruses can be spread through airborne droplets when an infected person coughs or sneezes. Contact with contaminated surfaces or objects. Adenoviruses can survive for a long time on surfaces such as doorknobs, countertops, and toys, and can be spread when a person touches a contaminated surface or object and then touches their mouth, nose, or eyes. Fecal-oral transmission. Some types of adenoviruses can be spread through fecal-oral transmission, such as when a person ingests food or water contaminated with the virus. Waterborne transmission. Adenoviruses can also be spread through swimming pools, hot tubs, and other water sources that are contaminated with the virus. Who is at risk for serious illness in adenovirus infection? Adenovirus infection can affect individuals of any age, but the severity of the illness depends on several factors such as the individual's immune status, age, and underlying medical conditions. Individuals who have a weakened immune system, such as those who have received an organ transplant, are undergoing chemotherapy or have HIV, AIDS, are at an increased risk of developing a severe adenovirus infection. Young children, especially those who are not yet immune to adenovirus, are also more likely to experience serious illness. Individuals with chronic respiratory disease, heart disease, or other underlying medical conditions may also be at higher risk of severe illness from adenovirus infection. How is adenovirus diagnosed? A healthcare provider may want to do a physical exam and possibly one or more of these tests to see if a virus or bacteria caused the infection. Blood test, urine test, swab from inside the nose, chest X-ray. What is the treatment for adenovirus? There is no specific antiviral treatment for adenovirus infection. Most people with adenovirus infection recover on their own without specific medical intervention, usually within a few days to a week. Treatment for adenovirus infection typically involves managing the symptoms. This may include getting plenty of rest to help the body fight the infection, drinking plenty of fluids to prevent dehydration, using over-the-counter medications to help reduce fever and relieve pain, gargling with warm salt water to soothe the sore throat, using saline nasal drops or a nasal spray to help relieve nasal congestion, using over-the-counter eye drops to relieve eye redness and discomfort associated with conjunctivitis. In some cases, healthcare providers may prescribe antibiotics to treat secondary bacterial infections, such as bacterial pneumonia or ear infections, that can occur alongside adenovirus infection. Individuals with severe adenovirus infection or those who are immunocompromised may require hospitalization for more intensive care, such as intravenous fluids or oxygen therapy. Prevention measures such as hand washing, avoiding close contact with sick individuals, and practicing good respiratory hygiene, such as covering the mouth and nose with a tissue or sleeve when coughing or sneezing, can also help reduce the risk of adenovirus infection. What can be done to prevent adenovirus infections? Preventing the spread of adenovirus infection involves taking simple steps to reduce the risk of exposure to the virus. Practice good hand hygiene. Wash hands frequently with soap and water for at least 20 seconds, especially before eating, after using the restroom, and after being in contact with individuals who are sick. Avoid close contact with sick individuals. Adenovirus infection can spread through respiratory droplets when an infected person coughs or sneezes. Try to avoid close contact with individuals who are sick, and stay home if you are sick to prevent spreading the virus to others. Practice good respiratory hygiene. Cover your mouth and nose with a tissue or your sleeve when you cough or sneeze, and dispose of used tissues promptly. Clean and disinfect surfaces. Regularly clean and disinfect surfaces and objects that are frequently touched, such as doorknobs, light switches, and keyboards. Practice good personal hygiene. Avoid touching your eyes, nose, and mouth, and avoid sharing personal items such as towels and utensils with others. By taking these simple steps, you can help reduce the risk of adenovirus infection and prevent the spread of the virus to others.